If you're wondering what changes the One Big Beautiful Bill Act made to health savings accounts, then you'll want to watch this video, as I'm going to discuss those changes as well as some of the reasons why an HSA account is a great way to save for retirement. Welcome back. This is episode 268. Saving enough for retirement is often a major concern for people 50 and older, and one way to save for retirement is through a health savings account, or HSA account for short. You might not think of this as a great way to save for retirement, but I'll be discussing some of the reasons why in this episode, as well as discussing some changes that were made to HSA accounts that are coming in 2026 as a result of the One Big Beautiful Bill Act. Before I get into that, if you're 50 and older and you want to learn more about planning for your retirement, then consider signing up for my on-demand retirement readiness course. It's a course where I walk you through how to plan your retirement. We talk about planning for taxes, insurance, Social Security, investing, Medicare, estate planning, and much more. The best part is that you get to go through this material at your own pace, and I provide you helpful checklists as well to put together your own plan for retirement. To learn more, head over to retirewithryan.com and click on courses and click on Retirement Readiness on Demand. So if you're not familiar with an HSA account, let's start off with talking about some of the basics about what an HSA account is. An HSA account, or health savings account, is an account that allows you to save for medical related expenses. If you're on a high deductible health plan, then you're eligible for a health savings account, an HSA account. And typically these are available through your employer. So with these accounts, you can make a contribution and your employer can make a contribution as well. The maximum for a single individual is $4,300 for 2025, and for a family, it's $8,550. So family is considered if you have any dependent or if you have a spouse that's under your health plan. And then if you're over 55, there's also a $1,000 catch-up to contribute even more. Now that contribution limit is the maximum between what you can put in and what your employer can put in. So for example, if your employer contributes $2,000 a year to your health savings account, then your reduction would be reduced by that amount as far as what you could contribute into the plan. And you can then use these accounts to pay for out-of-pocket costs for things that medical expenses that are not covered. So if you go to the doctor and you have a copay, if you need to buy a prescription, if you need to go to the dentist, if you need to get glasses or contact lenses, these are just some of the things that are covered. The IRS has a comprehensive list of what is covered, and I'll put a link of those items in the episode notes. As well as you can also pay for long-term care premiums. There's a limit based on your age, COBRA health insurance, and even some Medicare premiums. Unfortunately, individual health insurance plans do not qualify as an expense that would be able to be taken out tax-free from a health savings account. So secondly, who is eligible? As I said before, these are high deductible health plans that allow people to be eligible to contribute to a health savings account. So number one, you have to be on a high deductible health plan, and not any high deductible health plan. There are some high deductible health plans that are too high, meaning the out-of-pocket limits are too high and they would therefore not be eligible. So you want to check with your health insurance provider to determine if you're eligible to have a health savings account. And typically, as I said before, it's offered through your employer. So you would know if you're eligible because your employer would be offering you a health savings account that they would either be contributing to or that you could contribute to. Where it gets a little trickier is that if you buy your own individual health insurance plan, if you buy a health insurance plan through one of the healthcare exchanges, then you need to look a little bit further to determine if you're eligible to contribute to a health savings account. And one of the big reasons why, let's talk about some of the reasons why these accounts are such a great way to save for retirement. Well, the first reason is that they're a triple tax-free account. What does that mean, triple tax-free? It means that you receive a deduction on any contribution that you make into the plan. When you take the money out, if it's for a health-related approved expense, it's tax-free. And then while the money's in the account, whatever growth occurs on the money is also tax-free. So no other account gives you that triple tax-free advantage. If you think about a 401k, yes, you get a tax deduction when the money goes in, and the money also grows tax deferred, but when you take the money out, it's taxable. If you think about a Roth 401k, you don't get a deduction when the money goes in. Yes, it grows tax deferred, but then when you take it out, it's tax free. So no account gives you all three of those options. So that's why this account is so great. The second reason is that you can invest the money. As I said before, any growth you have on the money is tax-free. And this is where I see people making mistakes. They just leave the money all in cash. Maybe it's earning a low amount of interest. But typically, as you start to increase your contributions into your HSA, as your balance starts to grow, you're never going to need all of that money in 1 year. Typically, somebody that has an HSA might have a really bad health year and have to meet their out-of-pocket limit for their plan. So let's just say that was $7,000, your maximum out-of-pocket. Well, that's the most you could take out in any 1 year, theoretically. So if that's the case, then any money beyond what maybe your annual out-of-pocket limit would be, you want to invest that money. You could invest that in bonds if you're more conservative. If you're more aggressive, you could put that into stocks. You can put that into stock funds. You can get some growth on the money. And that's where you can really see the benefit of this health savings account and how it can be another great way to save for retirement. I'm a big fan of index funds, and that's how I have my money invested in my health savings account. That's how I recommend my clients do it. I use a bucketing approach, meaning I keep most of the money invested, and then I keep a small amount in a money market fund that if myself or my family has large out-of-pocket expenses, we can take that money out that's readily accessible, and we don't have to worry about selling a stock or a stock fund that's down in value. Additionally, when you reach 65 with these HSA accounts, you can also take out money and use it to pay for non-medical expenses or non-approved medical expenditures, and there's no penalty. If you want to take it out before 65, there's a 20% penalty. So once you hit 65, that 20% penalty is waived, and in that case, you would just pay tax on the money. It would work very similar to an IRA or 401k. If you take out money from your 401k, it's going to be taxable based on what your income is for that year. It's the same thing for the HSA. The difference, however, is that with a 401k, you have to be 59.5 for there not to be a 10% penalty. With an HSA, you have to be 65 for there not to be a 20% penalty. But that's why it's another great way to save, because at 65, if you want to access the money in the account, it's not for medical approved expenses, you can still take it out and it'll just be taxed like any 401k contribution would be. And for a lot of people as well, this HSA is really one of the only other pre-tax deductions that you have. If you're looking to save as much money as you can for your retirement and you're already contributing the maximum to your 401k plan and you're on a high deductible health plan, or maybe you could switch over to a high deductible health plan through your employer's health insurance, then that would allow you to be able to contribute to the health savings account and put in another, as I said before, $4,300 if you're single. If you qualify as a family plan, $8,550. And then if you're over 55, you can also make that $1,000 catch-up. So that's all pre-tax. So all of these contributions you're making are reducing your taxable income, which is saving you federal tax and state tax. So another thing that could benefit you is that if you live in a state where you have state income tax, and maybe you're planning to move to a state that doesn't have state income tax, any contribution you make to your 401k and also your HSA is therefore avoiding state income tax. And if you then withdraw the money when you move to a state with no state income tax, you'll never pay state income tax on that. There's no way to avoid federal income tax. That'd be really nice, right? If you could move to another country where there's no federal tax. But you are going to have to pay federal tax when it comes out. But the benefit of contributing now, hopefully, is that you're contributing where you're at a higher tax bracket, and then when you take it out, you'll be in a lower tax bracket. Additionally, your spouse can inherit your HSA. So a lot of people think I have to use up my HSA because when I pass away, it's gone. That's not the case. The money will still be there. If you have a spouse, they could inherit your HSA. They could then use it for their health-related expenses. And then when both of you are passed away, if you have children, they could inherit it, but then they would have to take it out and pay tax on it. Another reason is that you can reimburse yourself at any point for any expenses you've had, out-of-pocket expenses that you haven't reimbursed yourself for while you've had an HSA account. So what this means is that as you're spending money and going to the doctor, buying prescriptions, paying for whatever qualifies as an out-of-pocket HSA expense, you want to track that expense. If you want to save your receipts, that's one way. I personally have a file in Excel that I have saved on my computer, and then I save my receipts, and then I go in there, and every so often I punch in what my expenses are so that I know at any point how much have I spent out-of-pocket expenses that would qualify for HSA reimbursement. And then at any point, you can take this money out and you can reimburse yourself. So let's just say your HSA account's built up to $40,000 and you've spent $10,000 of out-of-pocket expenses over the last 3 years. And you want to go on a vacation around the world, a cruise around the world for $10,000. You could take that money out tax-free at any age, and because you're reimbursing yourself, there are no taxes that are owed. So that's why it's really important when you have a high deductible health plan and you have an HSA account, you want to make sure that you're tracking those expenses, either keeping the receipts, probably keeping the receipts and tracking it somewhere so you know what you've spent and you can reimburse yourself at any point. Probably better to do it later on, closer to retirement or even years after you've contributed to your HSA so that you can see the power of compounding and your money can have that snowballing effect, and hopefully you're just spending your gains and you're letting your principal, your contributions continue to snowball. Additionally, you can pay, as I mentioned earlier, for long-term care expenses, COBRA costs if you go on COBRA health insurance, and Medicare Part B and D, and Medicare Advantage after age 65. So if you go on, or when you go on Medicare at 65, even if Medicare is being paid for out of your Social Security, which is typical, because when you go on Social Security, your Medicare Part B will be automatically deducted before you receive your Social Security payment. Even if that's the case, and you have an HSA account and you want to take it out, whatever the Part B premium is for you, and reimburse yourself tax-free, you can do that. You can also do it for Part D, prescription drug plan. And you can do it for Medicare Advantage, but you can't do it for Medigap. So Medigap is the most comprehensive retiree health insurance that you could have when you're on Medicare, but unfortunately, you can't reimburse yourself if you go on Medigap. Medicare Advantage does qualify. As well as paying for your spouse's Medicare Part B, you can reimburse yourself. You could also reimburse yourself for Part D for your spouse and for Medicare Advantage. So that's another great reason why you want to probably be contributing to your HSA account, because you contribute, you get a tax deduction, and then you can take the money out tax-free for all of these types of expenses that you're going to occur at some point in your retirement. And even if you have way more in your HSA than you could ever reimburse yourself, you could also take it out just like an IRA and spend the money on whatever you want. So now let's talk about what these changes are. So there's two changes that were a result of the One Big Beautiful Bill Act. The first being allowing people on a healthcare exchange plan through your state. It now allows anyone on a bronze plan to be eligible to contribute to an HSA account. So if you were to go on the healthcare exchange and you were to look at the different plans out there, the bronze plans are the lowest coverage and also the lowest cost. Before this passage, and this again is in 2026, you have to be on an HSA, a bronze plan that includes an HSA account. And generally with those accounts, there's a higher premium and there's less coverage. But now, thanks to this, starting next year, you can be on any bronze plan and you'd be eligible for an HSA account, which is great. So that is allowing more people, it's estimated about 7 million people now would be eligible for an HSA account that weren't eligible for it before. It would be wonderful if everybody was eligible for an HSA account that was on any high deductible plan, but unfortunately, as I said before, that's not the case. The second change is that if you have a membership in what's known as a direct primary care plan, you can also continue to contribute to a health savings account. So if you're not familiar, direct primary care plan is where you pay your primary care provider a monthly subscription fee, kind of like the Netflix of primary care. So you pay $100 a month, and that gives you greater access to your primary care provider, maybe quicker appointments. Also, you can maybe do phone calls with them, telehealth appointments, and you get more of a concierge type service. Well, these were generally not eligible for HSA participants, but they are now. However, there is a limit of $150 per month for an individual or $300 on a family direct care plan arrangement. So these amounts will be adjusted annually for inflation going forward. However, if you have a direct primary care plan that's over that, you then still would be eligible for contributing to a health savings account. But I mentioned earlier, you don't ever lose your health savings account. So even if at any point you become ineligible to contribute to it, that money's still yours. You can still leave it in there, still leave it invested, use it over your lifetime as you see fit. One other thing to be careful for is that anytime you get close to filing for Medicare, you have to be aware that when you go on Medicare Part A, your HSA contributions need to stop 6 months prior, because there's a 6-month retroactive date anytime you go on Medicare Part A. And typically when you go on Medicare Part B, you also go on Medicare Part A. But some people feel that they should go on Medicare Part A as soon as they turn 65, because it is free as long as you or your spouse have worked at least 10 years in the United States. However, when you do that, it makes you ineligible to contribute to a health savings account. So you probably don't want to do that. You probably want to wait to enroll in Medicare A and B when you actually are going to retire, or you're going to lose your health insurance through your employer or through your spouse, and you're 65 and older. So something to be aware of, because people mess that up all the time. I wish that was one of the things that was part of the One Big Beautiful Bill Act that went away, because it is a problem. Because if you don't do this, then you have to go and you have to remove contributions and or earnings from your HSA account that occurred 6 months prior to enrolling in Medicare Part A and B. And even if these changes don't impact you, because they are minor, I still think an HSA account is a great way to save for retirement for the reasons I mentioned before. And if you are eligible for an HSA account, make sure that you're contributing to it, possibly even maximizing the contribution so you get the most out of it, and also make sure you're investing the money. I can't tell you how many people I meet with, clients and prospective clients, that have money in HSA accounts that are just sitting there sometimes earning zero interest. If you don't have the money invested, a lot of times it doesn't earn anything, so maybe switching it to even a conservative money market or bond account. And if you have a lousy HSA account that has not good investment options and doesn't pay you immediately on any cash that hits the account, you could check out some of my other episodes where I talk about what are the top HSA providers and what to look for when choosing an HSA provider. I hope this episode was helpful. If you have any questions that you want to have considered for a future episode, head over to retirewithryan.com and click on Ask a Question. And I look forward to talking to you next Tuesday. Take care.